Good afternoon, everybody. My name is Haley Yates. I'm the manager of strategic solutions at UBA. And on behalf of United Benefit Advisors and Benecon, I welcome you to today's presentation in our UBA Employee Benefit webinar series. Today's topic is ready to manage risk and cost in a self-funded plan. And our presenter today is Brad Kopcha, Executive VP of Business Development from Benecon. So with that, Brad, the floor is yours.
Sure. Thank you very much. Good afternoon, everybody. So as we go through this, very excited to talk to you, and I appreciate your attendance. Honored to be working with UBA. A lot of the consultants and brokers we work with throughout the country are UBA reps, and there's a level of expertise that they bring to the table. So we're happy to join together, go through this. So what we just want to go through today, high level, and the first slide we're going to just address is why is U.S. healthcare so expensive? As we look at the costs associated with healthcare plan in our country today, and looking back at some of the past sessions we've seen, you just see consistency on cost containment. But really, when we're looking at what 18% of our GDP goes to healthcare, what is driving those costs? And it's really a multiple layer of costs, right? So you have the insurance carriers who are looking at both the provider system, the hospitals. Their hospitals are blaming the drug system, and all of the above are looking at the population they are insuring and saying it's the morbidity of our country. Our country is becoming less and less healthy each and every day. So here we are as consultants facing really a daunting task of healthcare costs have been rising. I'd assume in your career, if I asked you, when did you start seeing claim trend in healthcare? You would say, well, it's always been there. It's been like when you were born, and the sun has always been there, and it's going to be there until the end. Healthcare costs are going to continue to rise. We are just in the midst of this. And so how do we effectively manage that? So as we go forward, what I want to look at is the purchasing dynamic. I am an actuary. I've been an actuary for the next 30 years. And Haley, on the next slide, there's a high level view of essentially how I look at the healthcare space and my time. I've been doing employee benefits in the healthcare space as an actuary for close to 30 years. And this picture right here is how I try to assess and look at my daily life. I'm at work. My wife will call me. We have 4 kids, and she will tell me on the way home to stop some days and buy diapers. Some days I have to stop and buy dates at this special store called the Country Store on the way home. And I have one son who claims he's lactose intolerant. There's no scientific proof of that. He had a stomach ache one time, and one of my wife's friends said maybe he's lactose intolerant. So now from that day forward, he's been lactose intolerant. So I have to buy soy milk, right? I'm not really sure what soy milk is. My dad joke is it's milk from Mexico trying to introduce itself. But each day I hear, oh, can you stop on the way home and buy this, buy this, buy that? And there are certain stores to go to. If I want to go to Costco for diapers, that's the best efficient place for me to go. Best quality, best price. Dates, I go to this Country Store, and there's a special store I go to get the milk where it's a little bit cheaper at the milk. So there are different places to shop to get the best quality. And so when we look at controlling healthcare costs, it's a much more complicated purchase than just diapers, dates, and soy milk, right? So on the next page, I have a overview of a little bit of what we want to control. And I go from the bottom up, right? So as consultants, this uphill battle, this daunting task we have is how do we shop effectively for our clients? What are they looking for? And how do we control costs with that shopping? We really have to unbundle the healthcare purchase and become experts in all of these spaces to be efficient for our employer groups. Going from the bottom up, the red, the admin expense, it is a small portion of our overall expenditure. You can see I have it represented in the pie chart. If you are in a fully insured plan from the Affordable Care Act, under 100 contracts, maybe 20 cents of your spend goes to admin expense. Over 100 contracts, maybe 15 cents of your spend. If you are self-funded, one of the big advantages of being self-funded is the savings and admin expense, right? You should be probably looking at 5 cents of every dollar you spend or less going to admin expense. But how do we shop effectively for our employer groups? What do we come to? Ideally, you want to get in front of your CFO that you're representing, your HR rep you're representing, show them the facilities their employees and dependents access the most through data, and then show them what is your recommended network to access those facilities in a cost-effective manner. It might be a tier network approach, but it might be what just has the better discounts in your area with a reputable TPA or ASO carrier. And I think from there, you move up to a self-funded purchase of stop loss. In the stop loss dynamic, we'll talk about that a little bit today. That is really the most important element of controlling costs. And the reason why is because when we hear all these things of controlling costs, the reality is controlling risk takes precedent over controlling costs. You can do a lot of things to control your costs. And if you're not managing your risk, you are going to be putting your employer in a situation where they cannot control their costs long term. So when you're looking at your stop loss policy, looking at what is the most efficient, best metric, what I have here down is claim payment. Are you working with a stop loss carrier that pays claims? What is your experience with that carrier? Are there coverage gaps? Does your plan doc line up with what your TPA and ASO carrier are going to pay, as well as your stop loss contract? Are all those lined up? What's your carrier's position on lasers and renewals? What's the loss ratio they're pricing to, deductible levels you want to use for your groups? All those are things you have to evaluate in your stop loss purchase. And then the last element is the rest of your cost is really the majority of your spend, which is claims that are routine and below the specific deductible level. How are you managing that risk long term? And I think as a consultant, the key is to partner with your employer and have a long-term approach. It really shouldn't be a year-to-year shop and hop approach, a spreadsheet approach. When I see the consultants I work with, and at Benecon, the oversight for myself as the chief actuary here, we have about $755 million of annual stop loss into our programs, and we work with hundreds of brokers with all throughout the country. About 2,000 employers are in our programs, and the ones that we see that are most successful at managing costs long term, they have a self-funded platform that addresses risk first, but then they partner with their employer of a multi-year plan of how they're going to control those costs together. Looking at the last couple sessions UBA ran in this webinar series, I thought there were just some fantastic points. And one of the things that was made in the June and July sessions was you can control costs, but don't do it at the expense of the member experience. And both sessions talked a little bit about RBC and some of the things you can do. But I really thought that was a perfect way to put it. Control costs, but not at the expense of the member experience. And I think what you're going to hear today from me as a theme is control costs, but not at the expense of the risk for the employer. If you're exposing your employer to too much risk, in the long term, they're not going to win the cost game. So if we look at breaking this up on the next slide, what I have is the couple of key dynamics, right? If you're looking at your employer's healthcare plan, their plan doc transitioning to protection, and also how to pay claims efficiently, there's really two main focuses, the cost and the risk. And often when you get in front of that employer, they're focused on what did they budget into their finances to control their healthcare costs. Do they have 12%, 15%, 8%, and then you're left trying to manage in the costs. Cost often is the primary focus. It's easy to understand, it's visionable, it's actionable. You could just make a plan design change. You could put a spreadsheet together and shop for the best and lowest price. But it's not a long-term solution. If you shop for cost, you're going to eventually get burned with risk. What I mean by that is the risk is a much more important element to control if you want to control costs. But risk is harder to quantify. Over and over, I see consultants and employers absorb risk at the benefit of cost without realizing the dollar amount associated with the risk they're absorbing, right? So I'll give you an example. Last year, I had a consultant who was shopping their self-funded, and they had the spreadsheet built, and they were looking to take lasers because they knew a couple of the individuals that were high risks were coming off the plan. The issue with that was, although those two individuals were known, what they were looking at were policies that were exposing the rest of the 500 members of that plan to significant risk in the long term, right? So they knew of a couple existing risks, but the developing unknown risk, that's there, and the employer has been exposed to the risk. I think another way to put it would be this. A couple of weeks ago, my son started football practice, my 8th grader, and they handed them out the general used equipment that the kids get. And then after practice that first one, I took my son to some of you may know Academy Sports, right? So I'm walking through the parking lot with my son at Academy Sports. And it's a great feeling walking with your son. You're proud of him. You're going into the sports store to buy the equipment. But as a father, I am going to that store and I'm buying him the mouth guard they gave him was pretty cheap. It was the standard team issue. I'm going to buy him an undershirt that has some pads in it already. And he had a hand me down from his brothers, but I wanted him to get a full, strong, well-fitting shirt. And it's all things when I went in there. I wasn't thinking about the cost of those items as much as I was protection and the risk. We're walking into the store, and coming out of the store was a father pushing a bike with his daughter who looked like 8 or 9, very excited. That's kind of like the picture of joy, right? A father walking out of a sporting goods store with a bike with his daughter pushing the other handlebar. And I'm pretty sure that father didn't go into the store looking for the lowest cost bike. He looked for the safest bike, the secure bike, because she's going to ride that for years. The least thing he wants to see is that bike have a wheel or something fall off as his daughter is driving it. But that is the essential element that you should consider when getting your employer a stop loss policy and managing your employer's risk. It should start with what is the safest way to manage that risk. And the last bullet point I have there, the risk is not where you should be saving on costs. If you're looking to save on costs, it should not be going with a spreadsheet, hopping and shopping each year on stop loss, going to a carrier you're unfamiliar with, a carrier you may not have worked with in the past. Locking in the risk is the most effective and first element of controlling your employer's costs. When it comes to costs, I said at the beginning, costs have risen. They're going to continue to rise. On the next slide, we have some of the elements of claim trend that we've seen in the past. We are using an estimate right now. Depends what survey you look at, where you want to see, but generally our actuarial team is using a 9% estimate for healthcare trend. The majority right now is coming from provider contracting. Post-COVID, facilities and hospitals have been getting renegotiated rates from the insurance carriers from whatever network you're accessing. They've seen some nice increases from their point of view. And a lot of that's driven by their cost of their labor. Morbidity is a factor. That's just the fact that our society is becoming less and less healthy. There's a lot going on. If you pinpoint and drill down on the morbidity, not just obesity, but mental health conditions are driving a large portion of that. Innovation and intensity. Intensity essentially is the fact that our society, which is it's fantastic. We could deliver the healthcare we can in America. But things we used to treat 20 years ago with an X-ray and rest now are MRI and physical therapy. And even more so, there's more and new drugs coming out in the innovation space. Those are going to continue to drive costs. Looking a little bit deeper of where this is coming from on the next slide, the provider contracting element, the cost of labor has been very significant. You can see in 2022, McKinsey study said that the cost of labor inside of the provider system is going to rise by 300%. If you look at where we are and when that study came out, that came out in 2022. We're at the tail end of that in 2025. And you could look back the last few years at the trend we've been seeing in the employer space. That is a large driver of it. Another driver of that is on the next slide, we talk about innovation. Many of you are familiar with a lot of the drugs, but one in specific that we've all been dealt with from a cost perspective is the GLP-1 costs. What we have seen across our book, and our book covers about 500,000 members. It's about several $1 billion of healthcare spend. So I think when I analyze that data, there is some credibility behind that. But the last few years, our employers have seen 3% trend attributable just to GLP-1s. It's about $36 per employee per month. About 2/3 of that is going to what would be deemed a medical necessity, with Ozempic being the dominant drug. A third, a lifestyle, which or kind of be called a weight loss drug. Wegovy is the dominant drug in that space. More and more employers are eliminating the coverage for the lifestyle drug, or they're putting up effective, I'd say, step therapy solutions or hurdles before you get these drugs. The ROI on these hopefully one day will materialize. At this point in time, we've not seen an ROI develop on the overall utilization of these drugs. About a little bit over of half the individuals who take these injectables stop taking them after 6 months. There are more therapeutics coming out into the space that are going to be pill form. Some of the initial pill forms, the costs associated with them seem to be very similar to these drugs, which would be over $12,000 or so for an individual for the year. There are lesser costs, things coming out into the market as well in this space, but I think having an effective strategy, understanding what these costs are for your employer you're working with, and recommending an effective strategy out there to control these costs is going to be key when we talk about cost containment and managing the costs. These claimants aren't necessarily hitting specific stop loss per se, but the overall expenditure on the plan is driving a huge strain on the aggregate stop loss. These are very, very material things that are hitting our market, and we're in the midst of it right now as consultants, having to drive. And I really recommend each of you have your own game plan, right? Have the solution in the space you have, bring it to your employers, and work with a consistent way to control these costs to the best of your ability. One of the last things I want to talk about is the outlook moving forward. In the next slide, I have a couple things that are coming down the pipe in the future. You know, claim trend has always been there in our career. I've been doing this for 30 years, and I've been dealing with it from the beginning. I think when I'm done being an actuary and I could retire one day, unfortunately, there still will be healthcare trend. In this space coming up as we look to the future, as long as we're doing this, the employer costs are going to continue to rise. This Medicare shift that's happening right now, the baby boomer generation is retiring. As they retire, and many of them go onto the Medicare plan, hospitals will be reimbursed at the Medicare rate versus what we're paying in the employer market. The national average in the employer market, and it varies by state, varies by carrier. Roughly, it's a little bit over 200% of the Medicare rate as a reimbursement. So as all these individuals transition to Medicare in the future, hospitals will be reimbursed for those same services at a lesser rate. It is assumed there will be some cost shifting going on through the form of provider contracting, putting even more strain on the employer market. So as we look at how are we going to control these costs, what is our methodology? What we do have to consider is the most, I'd say, optimal way to manage both cost and risk combined, which is the self-funded platform. Okay, so on the next slide, there's some things to consider. Going to a self-funded platform, it doesn't solve the employer's healthcare costs. Over and over, we have groups that go self-funded. They could see 5 to 15% savings in that first year, perhaps. But long-term, there is still healthcare trend. It doesn't solve healthcare costs. It just gives the best platform to manage those costs long-term. The issue with going self-funded, there's a couple things. One is based on the employer size, the historical self-funded solutions are basically built and skewed towards the larger groups, which we'll talk about. The other element is that there's risk associated with being self-funded, and often an employer believes they are safe and protected from risks by not being on a self-funded plan, but by being on a fully insured plan. And that's one of the things that you have to become an expert at. And there is a huge opportunity for you as a consultant, I would say, in the under 200 space, and I'll even specialize on if you could become an expert on self-funded solutions, safely taking employer self-funded in the 100 to 250 space with a multi-year strategy and controlling costs, I really think you'd be able to build a very reputable, large, successful book in whatever market you're in. Because as we look at the self-funded space, the next slide shows a little bit about where employers are self-funding and the size of those employers. You could see as this navy blue graphs go up, the larger the group size, the more likely they are to be self-funded. If you have over 1,000 employees on the plan, over 80% of those employers are self-funded. But if you have 200 or less employees on the plan, only 20% of those firms or those employees are covered by a self-funded plan. There are huge advantages to being self-funded. Admin savings, I talked about earlier, roughly 5 cents or less of every dollar goes to admin, which is much lower than the fully insured market. Tax savings, when you are self-funded, the premium tax is not applicable to all your payments of claims up to your specific deductible up to your attachment point. There is no premium tax on that. In several states, it's 2.5 cents of every dollar goes to premium tax. Underwriting gains, the fully insured underwriting world is a carrier building a model as same as stop loss. In both cases, insurance carriers are building models to make money off your employer's risk. You want to devise a self-funded plan that is safe, gives you a platform to control costs, but is minimizing any carrier making dollars off of the risk of your employer. Carriers are partners in this, and reputable carriers should pay claims and be, I'd say, compensated at the fair rate for the risk they are taking. But you want to be careful that you're not putting your employer in a program that when they have claim regression and claims come down, they're just generating an underwriting gain for the carrier they're working with. And then transparency. Being able to see the data is a huge advantage of being self-funded. It's why these larger employers that can be self-funded are self-funded. But on the next slide, what we shows is a 25-year trend of the growth of self-funding. And just looking at a couple of these lines, you could see the large employers with 1,000 or more workers on the plan. In 1999, the green bar, 62% were covered by self-funded plan. It's 84% last year. That actually peaked a couple of years ago in the 90s. We've seen a drop last year. There's a couple of reasons suspected of why, which one of the reasons I believe is some of these very high dollar drugs coming out. Some employers got burned on those, which I'll show in a couple slides. But the very bottom, I'd say line there is what I want to focus on, because I think that's your opportunity in your market, whatever market you're in. You could see in 1999, 13%, we'll call it small plans under 200 contracts, self-funded. And then going out to 2024, 20% of employees that worked for those under 200 space were self-funded. Minimal growth in that space. There have been things that have been come into the market. There have been solutions for the under 200 segment, and there are a lot of solutions in that space. I think what we do at Benecon and the Verus model, we have a large number of employers in that space. Our average group size is about 114 contracts. And what we want to do is go to this population and share with them, hey, you can be self-funded. You can take advantages of the admin saving, tax saving, underwriting gains, transparency, being self-funded, but you can do it safely. There's a safe way to do it. And if you understand the elements of a long-term cost containment, risk containment solution in this market under 250, you can go to the employer that understands that and really take that 20% number up to 50, 60, 70, 80% of your market. That is where I think the growth opportunity is there. As a consultant, we look at the small and medium-sized businesses in our country that are not self-funded, that should be. Those are the groups we can go to with a solution, with a playbook, and drive huge savings and huge advantages to you as a consultant. So with that, we talked a lot about cost, look about the advantages of self-funding. I want to talk about risk a little bit. So the next slide, we're going to take a deep breath. And I did share I'm an actuary, right? So we're going to get into this risk and how do you protect risk. And this slide here is really here for a couple elements, right? I've been going hard with some insurance stuff, and you logged into the webinar right after lunch, so you like insurance too. We're in this world, but if you look at these elements here, whether it's the movie Aladdin, right? Jasmine gets on a magic carpet to go on a ride with a prince, and she was willing to take the risk of the magic carpet, right? So I'm an actuary. You're going to go home and how was work today? And you could say, well, I sat through a webinar with an actuary, and I will tell you, Jasmine had to get on that carpet because you cannot measure the ROI of jumping on a carpet with a prince, right? What's the ROI of love? What is that number? You can't tell, right? But you have to take that risk. You go to work, you have this movie that came out with Blake Lively, Justin Baldini. Who knows what the truth is, but there are massive lawsuits that are damaging both their careers, long-term impact. But I'm sure when they both signed up for that movie, they were extremely excited, and neither of them can imagine they're where they are today with the reputation, the damage, the things that are happening with that lawsuit between those two. But there was risk when they signed up for the movie, and they weren't even thinking of that risk. They were thinking of the upside. And then I put Patrick Mahomes on here, right? Perhaps the best quarterback playing football today. But every time he takes the field, there is huge and tremendous risk associated with that. But the upside of it is something you can't avoid, right? Being a Super Bowl MVP, in all these elements, being a movie star, finding love, that you have to go for all those things. But there's always going to be risk associated with it. So what we look at with our employers is really how to manage risk effectively. You can be fully insured or self-funded. I think the fallacy that employers think, and we as consultants have to explain to them, is fully insured is not less risky than a self-funded plan constructed properly. All right, I'll say it again. Being fully insured is not less risky than a self-funded plan constructed properly. A self-funded plan constructed properly is actually less risky than a fully insured plan. A fully insured plan is really designed for the carriers to make money off of that risk pool that they are insuring, and the employer that's part of that fully insured plan is part of that risk pool. We have over 2,000 self-funded accounts. On an annual basis, we may see 3,000 to 4,000 employer groups come to us nationwide, looking for a quote for our Barris program, or looking for consulting help. We have consultants all throughout the country send us quotes, so we get to see a lot of quotes. And I've been doing this for quite a while, so I've seen some things in the healthcare space, and a couple of them that I would say I would like to say greatest hits, but they're not greatest hits. They're just unbelievable renewals. How about we'll call it that? Unbelievable renewals. I'd like to share one from the fully insured spot on the next slide. The fully insured renewal I'm going to show you, it was a 647% rate increase. It was from a blue plan to an employer. You could see the end result of this was that an individual was being offered a coverage that was going to amount to over $60,000 a year. A family contract was going to be around $180,000 a year. And it's just something unmanageable. So you think you go to a blue and you're safe, but you could see what happened here. And this is a real renewal that got sent to us from an employer looking for help. One of the things that's amazing in this, and I know it's pre-populated and it's on every renewal, but they gave this group a 647% renewal, and then the very bottom they said they could do some plan designs to drop that renewal to 644.85%, which I think is just an unbelievable part of this. But this is real, right? I am pretty sure the employer going into this did not realize they were exposed to this type of risk in a fully insured plan working with a blue. And then on the self-funded space, I'm sure many of you have some, what I actually say is horrific stories about employers that are exposed to risk in the self-funded space. But on the next slide, there's one that we like to share, a $4 million laser, right? So I'm going to assume I don't have to go through the details of a laser and how this could occur, but it just shows that employers are exposed to more risk than they realize when they come up for the renewal. I think it's when the strategy is to shop and hop and to go for the cheapest price, and it's probably in both these cases the year before they may have gone with what was the cheapest option. It's that bike that's going down the road that the wheel falls off. It is why you could do whatever you want to do from a cost containment, whatever your preferred methodologies are. But if you don't have the risk locked down, this could occur. This is real. These are real employers. These are real renewals. And I wish I could say this is the only time I see things like this, but it's not. We get sent in self-funded renewals all throughout the country from consultants, claims not getting paid, massive lasers. It is a huge issue in our space. So there are these advantages of being self-funded. But as we look forward and we take our employers to the self-funded space, we are taking them to a very risky world with technology advancing at a record space, both like, you think of AI and what's happening in the tech world, but in the healthcare space as well. The next slide just goes through some of the details here of some of the drugs that I'm sure you're familiar with, but some of these things came out into the market. And the reality is, these are fantastic drugs. These are fantastic developments. And it is amazing that in our country, we're providing healthcare that the employers give out access to networks, access to, blue ASO carriers, and their population can get these drugs. It's really something we should be thankful for. These are amazing items. These are amazing things. If any of our loved ones had this, we'd want them to have access to that. And generally they do in our country. But there's a huge price tag and a huge risk, right? So in the, I'd say, days prior to these drugs being introduced to market, some of these conditions that came out, if an employer had an employee on the plan or dependent on the plan who had this condition, what would happen is it would be paid over a lifetime of 20 to 26 years while that employee or dependent was going through the treatments. And in that time frame, most likely that employee would have multiple employers, right? So the risk to the employer was not as great as it is today. For those conditions today, it is a much more material risk, because if you have an individual on your plan, one of these conditions comes up, they're diagnosed, they get this treatment, that $2 to $3 million drug hits in 1 year now. It is a much different risk dynamic for those conditions. Example would be sickle cell. A couple of years ago, I think it was December of 23, a drug was introduced to the sickle cell space. And historically, that might cost $40,000 to $60,000 to treat a member on your plan who had sickle cell. This drug came out, which was up of 800,000. So now where you had somebody who was 40 to 60,000, now they could be, if they were eligible and diagnosed to take this drug, prescribe this drug, an $800,000 hit in any 1 year. So you don't know necessarily what your claim conditions are, because some of these drugs that are being introduced to the space are being done around the clock. There are more and more coming out in the gene and cell therapy space. It is just a massive risk our employers are subject to. It's more and more a reason why, when you're looking at this self-funded solution, you have to have your employers in a long-term solution. There are a lot of good policies out there that talk about, well, it's a 1 year rate cap, 1 year, no new lasers, which is fine. It's still rolling that dice year after year after year. Eventually, your employer, who's saying they're going to be in business not for 1 year and 1 year, they're going to be business indefinitely, right? For perpetuity. They're looking for a long-term solution, but it also helps you as a consultant going into your employer and getting them on a long-term solution, managing self-funded. Year one, we're going to look at your data, get you to the right facilities. Year two, we're going to introduce this solution. Year three, this solution, and having a partnership with them as their consultant, controlling and containing costs. But step one would be to lock down that risk through an effective stop loss policy. What do we look for in a stop loss policy? Some high level things on the next slide I just want to walk through. Number one would be working with a stop loss carrier that pays the claims. When you look at that self-funded platform and what should be effective, are you working with a carrier that is known for paying their stop loss claims? Another key element on the next slide that we talk about is the realistic aggregate protection. We see stop loss policies over and over that put out 25% corridors or 25% attachment points, whichever you want to call it. And that number is being set by a stop loss carrier. And if you do the math, it's really like a 33% attachment point. Really aggregate protection the group will never use. Many of you are probably familiar with groups don't even buy ag protection. But when you're going to work in the 250 and under space, a aggregate protection that's real, that can be hit, is probably part of their overall risk dynamic, something you want to look at. For larger employers, they might not be as interested in that aggregate protection. That makes sense. Transparency of performance. There are programs out there that aggregate employers together to go to the stop loss market. Many of them are constructed well and are very reputable, very strong programs. There are some other ones, though, that don't share couple elements. One, we're familiar with one that doesn't share with the groups what their claims are. It's a self-funded program, but the groups don't get to see what their claims are. It's hard to imagine in this fiduciary environment that can be done, but there are employers in that program. There's other employers and programs that they don't know how the overall program is running itself. They don't see how that program's running, or the carrier's making money, what it's doing collectively. But I think there should be transparency of performance in what you're doing if you're going to join an aggregation program. And then employer protection. Is the stop loss coverage they're entering into renewable? That was a big part of the Affordable Care Act to make sure that insurance was renewable. The stop loss doesn't necessarily have to offer you a renewal. If you develop some claim conditions that are pending, a lot of transplants pending, other things they know about, do they have to even offer you a policy? Is your policy renewable? The no new lasers, is it 1 year? Is it multiple year? And the rate caps, is it 1 year? Is it multiple years? All of those things being renewable, no new lasers, rate caps. It is common now to see maybe you can do it for sign up and a 1 year provision, but your employer is going to be in business for multiple years. You just have to be mindful of having a long-term risk strategy in that self-funded space. Total renewal management. What I'm talking about that is if you're going to take a group under 250 self-funded, is their max liability something that is budgetable? Is it something that is being managed? Are there caps on the attachment point renewal in any given year? And the way I think effectively to do it, when you're looking at your risk and your carrier partners you're working with, and really whatever plan you're working with, there has to be an employer focus. Healthcare is expensive enough as it is without being, I'd say, focused on an employer, their risk, their underwriting. They don't need to be paying for other individuals' claims, subsidizing other individuals. But you have to be working with a carrier that you have partnership with, that you as a consultant trust, individuals there you trust, that you've seen them come through for you before, and expressing that to the employer. That sometimes the lowest stop loss price is not the best price. The lowest plan is exposing that employer to risk, and building that trusting relationship with your employer to guide them through that. So the very last slide I want to talk about is just going through again those advantages of being self-funded or fully insured. Why do we see the majority of the employees in the country today on a self-funded plan? The admin savings, being on a self-funded plan, considerable admin savings relative to a fully insured plan. Tax savings, the state premium tax does not apply to those dollars paid below the specific deductible. Underwriting gains go back to the group. Transparency, seeing where every dollar goes when you're self-funded, huge keys of being self-funded. It's very hard to control your costs if you don't see where your claims are and what your claims are. But once you do, it's opened up a whole world of opportunities. So if you have this cost containment focus, building a multi-year strategy and approach with your employer, once you lock down that risk, once you have them understanding those benefits of being on a self-funded plan, now it's building a multi-year program with them, a multi-year strategy with them to control the costs. When you look at that, it starts with that TPA relationship, or the ASO carrier you're working with, but what is the most effective network for them based on their utilization, expressing that to them, proving that to them through data. I have seen multiple TPAs fail employers, not putting in the benefit design correctly, not paying claims, adjudicating claims appropriately, working with a strong and reputable TPA that you trust and you know and you have experience with is vital to delivering cost containment. And a lot of these TPAs have amazing cost containment strategies, right? I think the last few sessions that you saw here, the June and July UBA session, you had some very reputable, very solid solutions brought to you from the TPA space. Plan design. A lot of times, a lot of the savings that employers go after through shopping can be basically achieved greater through very minimal plan design, strategy on a very given year, putting in a plan design that addresses consumerism, right? Understanding the HSA world, and if it's the right solution for your employer, being an expert at implementing HSAs and using those appropriately with your group. A dependent strategy, understanding your employer's, I'd say, risk appetite for having dependence on the plan, understanding what they're paying for dependence on the plan. Are they willing to have some sort of and I'd say maybe not spousal exclusion, but spousal strategy, dependent strategy, working with them on that. Drug evaluation, I think that is something we all recognize now. We cannot go in front of an employer without examining their drug spend, examining long-term, what is the appropriate plan design, taking that drug spend and looking at what is the most effective way for them, looking at total cost of the drug spend, not just the rebate dollars. Facility steerage, I think that's a big part of this. If you have employers that have access to multiple facilities, what is the most efficient one? And is there a tier network approach or an approach to guide their population to the most efficient, maybe it's a center of excellence, but the most cost-effective way? And one of the key ways to do that is through data analytics, looking what's driving the solution, what's driving the cost, and then providing the solution. Third-party vendors, having and knowing of some very reputable third-party vendors that do deliver ROI. There are multiple third-party vendors we work with that we see very high probability of ROI, as long as the employer is using it properly. They deliver ROI again and again and again for our self-funded accounts. And those are the third-party vendors we recommend. And then I'd say your value as a consultant, it's not just shopping. I would limit it to, if you're looking at the spreadsheeting each year, shopping with the fully insured prices each year and whatever the price you're getting back from the insurance carrier, I think you're limiting the solutions you could deliver to an employer. I think the very beginning, when I talked about the shopping, when I'm going home and I'm buying the diapers, the dates, the ASO network, the stop loss, and then controlling claim costs, really it is shopping those elements, unbundling your employer's plan, taking them to the most efficient risk and cost strategy in each of those elements, and delivering them on a multi-year plan, partnering with them so they understand this is happening. I'll close with this. I've been delivering renewals, as you have, I'm sure, for years. It's hard. It's a weird, challenging world we chose to work in. A couple of weeks ago, I went to a CFO of an employer, and it's an employer I've done work with for years. Very good job, and that came in for the healthcare renewal, and the CFO said he woke up, dreaded this meeting, and it's the worst day of the year. And it's, when you come in that room and these employers have this ongoing healthcare expense going up, they're looking for us for solutions. They're looking for us for risk solutions. And it's a challenging world, but I think it's a world worth fighting for. I really think what you're doing for the employer market in our country is vital. The employer market in the United States in the healthcare space is extremely important to our economy, extremely important to who we are when we deliver benefits to our employees for all our clients. So it is a challenge, but we at Benecon recognize this challenge and want to join you in this in delivering the most cost-effective risk and health solution. So with that, I thank you for your time and appreciate so much UBA offering this opportunity to me. Truly honored. And for those UBA partners we work with out there, I thank you so much. Thank you, Haley.
Yeah, thanks, Brad. We did get one question. I think it was during the second graph that we shared, so I'll bring it up if it's relevant. But question is, of the groups that are self-funded, do you have valid data on how many groups are in an ASO instead of an unbundled self-funded platform, i.e. renting a network, independent PBM, independent TPA?
Yeah, I don't have I'd say a reputable data where I could say, okay, this is how they are breaking up ASO over TPA versus carve in or carve out. I think it's all over. It varies by market segment. I wouldn't say any one of those is the right solution every time. I think when you get in front of that employer, you have to meet that employer where they are, to accepting risk, accepting costs, knowing where they are. And I think as a consultant, we have to be able to deliver that. I've had consultants in the past that always walk in and it's always TPA carve out with this TPA, and that could be understandable and a great repeatable pattern. But sometimes you walk into an employer that needs that ASO blue solution. So I think it's important that we're flexible, that we can deliver both, including the carve out TPA solution when appropriate.
Awesome. Thank you, Brad. If anybody does have any questions after our webinar today, feel free to reach out to me directly or the Benecon team. Happy to point you in the right direction. But I want to thank you, Brad, for your thought leadership and sharing your expertise today. And also thank all of our UBA partner firm employees who joined us, and any clients as well. Our next webinar in this series will be on September 16th with Allstate. So thank you all again for attending our employee benefit webinar series, and we look forward to you joining us next month.